lives without being too medicated, but to be free from seizures. And sometimes that can, with the patient's physician, mean that they are going to have to change the medication dosage somewhat, but the patient does not need to do this on their own, nor could I as a nurse over the telephone, or can you as a nurse. So you cannot tell the person, oh, you're too sedated, so just take a little bit less of your medicine. Of course, I know you wouldn't do that. The patient might try to do it on their own, certainly, but be sure and tell them it is very important to take their medications on time, to call their physician if they are ill, if they're vomiting, something's going on where they think they may not have received enough of their medication. We also want to identify the cause and contributing factors if so, and the goals of therapy are to improve quality of life, reduce the frequency of seizure, and to minimize adverse effects, just like we just talked about. And once again, this just goes over management of seizure activity for you as the nurse, about protecting your patients, and you were just tested on that, but you can review that. And I will be sure and put these answers as you look through these and answer them. I'm not going to take the time to do it, but I will post the answers for you. Okay. Back one. Whoops. Okay. Also, teaching plan for a seizure disorder, taking history, describing the seizures, recording the post-itical behavior, identifying a care plan, proper supplies, and discussing this with the patient and the family. It can be very scary for a family who's dealing with a seizure disorder, for their partner or their child or even themselves. But they do need to document what's going on and keep a record so that they can talk with the doctor about it. Encourage patients to maintain medication regimen like we talked about. All right, management of seizure activity. We just looked at that, didn't we? Maybe? Okay, do not leave the patient, horizontal position, turning the patient to the side, allowing secretions to drain, suction, give oxygen if needed if you're in the hospital setting, providing safety and comfort during the post-itical stage, and report all aspects of the seizure. Oh, sorry, I think we did that twice. Okay. Seizure disorder, symptoms of an abnormality in the nerve centers of the brain. Chronic and recurrent seizures point to epilepsy. So, like we learned before, if you can eliminate problems that are going on and the patient still has seizures, then they could be labeled as having epilepsy. And there are two broad categories, generalized seizures and partial, which you already tested on. And now let's look at some medications. Sorry about that. Okay. Benzodiazepines. Now, I want to refer you to a chart. Very good chart in your book. And it is on page 272. Looks like this. Okay, benzodiazepines. You see there that you have included in that diazepam, lorazepam, which I believe were assigned to you. One of those was, no, both of those were for drug cards. So when you're looking at this chart, be sure and look all the way over to the right-hand side and see what type of seizure it covers, the use for seizure. And you can look at your dosages, your availabilities, but you are not going to be tested on your dosages. Mostly for questions on your test, you are going to be questions about safety issues, side effects, adverse effects that more so need to be reported. So if it's going to cause a problem with your patient, then that's what more so you're going to be tested on for this test. So you're not going to have to know, is it 5 milligram, is it 3.75 milligram, something like that. Now, when you're looking at your chart on page 272, you see over in the right-hand column, use for seizures, and in that section, you see lorazepam, which is Ativan, and you see on the far right that it's used for status epilepticus. So that's important. And as you look down the rest of that chart, you're going to see what we're going to talk about in a moment, your hydantins and your succinimides. So we'll mention those in just a second. Okay, your benzodiazepines. They are thought to enhance the inhibitory effects of GABA in postsynaptic clefts between the nerve cells. Don't have to remember that, but what you do need to remember is they cause sedation, drowsiness, dizziness, fatigue, lethargy, blurry vision. You may have had to take a benzodiazepine at some point in your life. Miss Zumbrin, I have to take something like that if I fly. Not so much anymore, but in years past I did. But yes, certainly that caused sedation and drowsiness. So I would get nice and sleepy on the plane. So that is just a common effect of that. Serious adverse effects, hepatotoxicity, behavioral disturbances, and blood dyscrasias. So liver enzymes would need to be monitored for this patient. Okay, your hydantins. All right, they are anticonvulsants to control tonic-clonic seizures. Anticonvulsants to control tonic-clonic seizures. Common adverse effects, nausea, vomiting, indigestion, sedation, drowsiness, dizziness, fatigue, lethargy, blurry vision, and then gingival hyperplasia, hyperplasia, which is really a gum overgrowth that can occur from taking this medication. So patient needs to practice good oral hygiene, so hopefully this doesn't happen. I have seen some patients who are, over the years, special needs patients who more so had a problem with this, and they can't brush their teeth on their own. Someone's doing it for them. And, when life gets busy, I guess that can go by the wayside sometimes. But make sure that's stressed with patients about good oral hygiene to prevent that hyperplasia of the gums. Hyperglycemia, it can also cause this in a patient. Your dilantin, which is a hydantin, can cause that. Hepatotoxicity, dermatologic reactions, succinimides. Okay, you've got a couple of examples here. These are to control petit mal seizures. Okay, and looking over your common adverse effects or side effects, nausea and vomiting are very common. So succinimides, common adverse effects, nausea, vomiting, indigestion, particularly at the beginning of therapy. Okay, miscellaneous anticonvulsants. This is Tegretol. And uses in combination with other anticonvulsants to control tonic-clonic seizures. It also treats trigeminal neuralgia, manic depressive disorders when lithium's not optimal, and common adverse effects, nausea, vomiting, drowsiness, or dizziness. So if you have a patient who's experiencing nausea and vomiting with their medications, if it's time to take their medicine, maybe they need to eat a snack prior to taking their medicine. That could be important. And keep in mind with your Tegretol, just like it says, as you learned in your other chapter, that it is used to treat trigeminal neuralgia, also tonic-clonic seizures. And you have another chart too on page 268 in your book. Looks like this. And it says on page 268, anti-epileptic drugs of choice based on types of seizures. So that breaks it down a little bit more for you too. And you've also have a section on partial seizures there as well. So that's a good chart also to look at. Okay, with Tegretol, you see some serious adverse effects, potentially fatal skin reactions, orthostatic hypotension, shortness of breath, edema, nephrotoxicity, hepatotoxicity, and there's numerous drug interactions. Okay. Gabapentin, also Neurontin. I know that if you work in long-term care, you've seen this medication a lot. Used for a lot of things. Also used for seizures, anticonvulsant to control partial seizures, and of course a lot of people take it for neuralgia. Common adverse effects, sedation, drowsiness, dizziness, blurred vision. Although you very well may have a question on your NCLEX or on your HESI exam about gabapentin, there is not a question on your test that you will take Tuesday about gabapentin. You do have to do a drug card, and just to review, you are doing drug cards on lorazepam, which is Ativan, clonazepam, which is Klonopin, Neurontin here, gabapentin, and also Sinemet, carbidopa, levodopa, combination drug is Sinemet. Those are your 4 medications to do your drug cards on. Okay, Lamictal, also called lamotrigine. I think I'm saying that correctly. In combination with other anticonvulsants to control partial seizures and common adverse effects, nausea and vomiting, indigestion, sedation, drowsiness, dizziness, and blurred vision. And 10% of patients develop a skin rash and hives that could become more serious. So if your patient calls in and has a rash, has hives, report it to the physician and ask them what they would like to do. They may want to change the medication somewhat. They may want to just wait and see what to do, but it does need to be reported by the patient. Also, any signs of stiff neck, fever, because meningitis has been associated with use of Lamictal also. Keppra. Okay, Keppra is a medication that I heard quite frequently when I talked about I had these parents calling in for these older children. And the generic form of this is levetiracetam. Levetiracetam. It's used in combination with other anticonvulsants to treat adult partial onset seizures. Causes weakness, drowsiness, and dizziness. There will not be a question on your test regarding Keppra. Nor will there be, will there be a question about Trileptal also. It can be single or combination therapy to treat partial seizures. Causes confusion, poor coordination, drowsiness, and dizziness. Phenobarbital, and this one has been around forever, but luminol. It is a long-acting barbiturate, elevates the seizure threshold, and prevents the spread of the seizure. It's primarily an alternative when a single anticonvulsant is unsuccessful. I know years and years ago, when I used to watch medical shows when I was little, they talked about using phenobarbital quite a bit. Lyrica is not on your exam. Chemically related to gabapentin. Controls partial seizures, diabetic neuropathy, and neuralgia. Okay. These two, sorry, missed one there. Myceline, used for tonic-clonic seizures. We do not have that one on your exam. But as I said, be sure and read through these just in case. Try to get familiar with seeing the name and associating it with tonic-clonic seizures. And Gabatril, used for partial seizures. Topamax. You'll see this one quite a bit. I did too when I had my call-ins. It is a combination drug with other anticonvulsants to control tonic-clonic seizures. So Topamax, used for tonic-clonic seizure, also for prevention of migraine headaches. So highlight that. Tonic-clonic seizures, migraine headaches, common adverse effects, sedation, drowsiness, and dizziness. Serious adverse effects, neurologic changes, cleft palate in newborns. So therefore, you would not want your pregnant mom to take Topamax, possibly your patient of childbearing age. So there needs to be a caution flag with that. Causes decreased sweating and overheating, especially in children. And enhanced sedation with central nervous system depressants. Depakine is valproic acid. It's used for tonic-clonic seizures. It's the only single drug therapy to treat combination of generalized tonic-clonic, absence, or myoclonic seizures. Causes nausea, vomiting, indigestion, sedation, drowsiness, dizziness, blurred vision. We're seeing that a lot, aren't we? Nausea and vomiting as a side effect. And if you see here also, it can cause birth defects, neural tube defects, craniofacial defects. So red flag once again for pregnant patient or childbearing age. You will not be tested on Zonegran, but is used to control adult partial seizures. And that's it. Okay. Wanted to go over a couple of more things as far as Chapter 18. At the beginning of your chapter on page 266, you have some blue terms here. And like I said, once again, review your seizure disorder. So read through page 266, 267 to make sure that you could answer a couple of questions about types of seizures. And you see here listed in your blue words here, you have your seizures, different types of seizures to review, including status epilepticus. And I also would like for you to, we mentioned it, but to look over gingival hyperplasia on page 270, and also nystagmus on page 274. I don't think, maybe we've mentioned nystagmus before, but it's just back and forth movement of the eye, and it can be associated with toxicity to medications. So be sure and read through that section as well. Let's see. Anything else I need to tell you about that? Okay. Make sure on your slides that we went through that you look at your common adverse effects, serious adverse effects for each slide, in Chapter 18. If nausea and vomiting is a common adverse effect, then talk to your patient, like I said, about having it with a snack. Talk to the physician about this if they're having vomiting, because if they're vomiting up their seizure medication, then they're not going to be well controlled. So that needs to be discussed as well. Okay, I think that will wrap up for Chapter 18. When you are tested next Tuesday, there will be a couple of medication questions. They're very simple math. You won't need a calculator, but they are there. You do not have to memorize dosages of these medications. I think I mentioned that, but once again, so don't spend your time going over what the milligrams that are supposed to be given for your medications. Spend your time with what type of medication is it, what type of seizure does it cover, are there some safety issues with giving the medication that are very important in your nursing practice. Thanks for your attention.